Hey guys, welcome back to my YouTube channel. On today's episode, we'll be discussing drug administration. Let's get started. The route of drug administration. The route of drug administration refers to the method by which a medication is introduced into the body. The common routes of drug administration include oral, that is through the mouth, topical on the skin, parenteral routes, and other parenteral routes. Drug can be given either intravenously, intramuscularly, subcutaneously, or intradermally. Drugs can also be given through inhalation, that is through the nose, and also through the rectum. Each route has its own advantages and disadvantages in terms of speed of onset, effectiveness, and potential side effects. For example, drugs given intravenously, they have a rapid onset of action since they are given directly into the blood, while drugs that are taken orally take some time before the work. So now, let's go into details. The oral route of drug administration. The oral route is the most frequent route of drug administration, and it rarely causes physical discomfort in patients. Oral forms of drug include tablets, capsules, and liquids. Some capsules and tablets contain sustained release drugs which dissolve over an extended period of time. Administration of oral drugs is relatively easy for patients who are alert and can swallow. That is, the indication for giving oral drugs to patients is that your patient must be alert and can swallow. Nursing responsibilities for drug administration through the mouth. As a nurse or as a nursing student, you need to observe the following points when giving an oral drug. Place your patient in an upright position because it is difficult and as well as it is dangerous to swallow a solid or liquid while lying down. This is done to prevent aspiration. Make sure that a full glass of water is readily available. Assess the patient's need for assistance in removing the tablet or capsule from the container, holding the container, or holding a glass of water. Some patients with physical disabilities cannot handle these objects and will require assistance. Advise the patient to take a few sips of water before placing a tablet or capsule in the mouth. Instruct the patient to place the pill or capsule on the back of the tongue and tilt the head backward to swallow a tablet or slightly forward to swallow a capsule. Encourage the patient first to take a few sips of water to move the drug down the esophagus and into the stomach, and then to finish the whole glass. Give the patient any special instructions, such as drinking extra fluid or remaining in bed, that are pertinent to the drug being administered. Never leave a drug at the patient's bedside to be taken later, unless there is a specific order by the primary care provider to do so. A few drugs such as antacid and nitroglycerin tablets may be ordered to be left at the patient's bedside. Patients with nasogastric feeding tube may be given their oral drugs through the tube. Dilute and flush the liquid drugs through the tube. However, crush tablets and dissolve them in water before administering them through the tube. Before administration, check the tube for placement. Flush the tube with water after the drugs are placed in the tube, and this is to completely clear the tube. Instruct the patient to place buccal drugs against the mucous membrane of the cheek in either the upper or the lower jaw. These drugs are given for local rather than systemic effects. They are absorbed slowly from the mucous membrane of the mouth. Examples of drugs given buccally are lozenges and trunches. Certain drugs are also given by the sublingual route. These drugs must not be swallowed or chewed and must be completely dissolved before the patient drink or eat. Nitroglycerin is commonly given sublingually. Come to the end of today's episode on drug administration. I hope you've learned one or two things and your knowledge about oral routes of drug administration has been updated. Stay tuned to my YouTube channel and click on the notification bell to get notified when I drop a new video. Thanks for watching. Bye.